MCH has the best data of any part of public health.
Absolutely.
You know, pregnancy lasts 9 months and then you see what happened. So we all started, you know, actually Dr. Sappenfield, who was at CDC, helped us figure out how to start using our data effectively. Before that, we just sort of made stuff up, and you know, our data was better than theirs because they didn't have anything. But from a policy standpoint, using data effectively is amazingly important. Even though we have some anti-scientific politicians, most of them will ask you, show me, you know.
Right.
And then the other very effective part of data is the health management part of it. What are you going to save them? Because, you know, some politicians will help you out because it's the right thing to do. Some will help you out because it's going to save a bunch of money. I'd say the best are right in the middle somewhere, but you got to deal with both issues. And so we're very effective at doing that, and I mean we in the big way, because we established the Florida Healthy Mothers, Healthy Babies Coalition, which was interested people from around the state, not necessarily professionals, many of them were. And we selected people from various groups like the OBGYN Society. Instead of calling them up and saying, send us somebody, because I'd been on their committees before, and there are professional committee goers, we'd say, send us Dr. Jones from Ocala because we really know he'd be interested in this. And Dr. Jones would come and he'd be engaged, and he was with it. And so those people really made a big difference when we went to the legislature and the governor, because they were all behind it.
Right.
So it's very hard for one person to make a policy change. You need a group of people. The other thing that you need is, if you're going to do something really big time, it may take you 2 or 3 years to get something big through, and you can't give up. You just got to be persistent. And then people need, another skill people need to learn is presentation skills. You know, how do you present something in 3 minutes? You know, like they say, the elevator speech. People should be trained in, if they're going to be running an agency or helping run an agency, in ambush interviews.
Describe it.
How do you deal, you're walking out of a committee meeting or somebody, and the press jumps in front of you and says, you know, you said this in there, prove that that's for real. And you go, well, you know. So I think those are all great skills to have. For people that aren't, that want to be leaders in MCH, I think you have to learn to be better public speakers. You know, there are things like Toastmasters and other clubs you can belong to where you can improve your skills. You know, my kids used to make fun of me, and I'm catching myself doing it here, is that I would say every other word, and they just started making fun of me about that. So that I didn't kill any of them, but I did try very hard not to keep doing that.
You're pretty good at not doing that.